Today we are going to talk about a very common but often unnoticed problem called tongue thrusting habit. So what exactly is tongue thrusting? Normally when we swallow, speak, our tongue rests gently against the roof of the mouth just behind the upper front teeth. But in tongue thrusting, tongue pushes forward, pressing against or between the front teeth every time we swallow, speak or sometimes even when we just resting. So let's look why the habit develops. It's quite common in children, especially using a pacifier or a feeding bottle for a long time, had thumb sucking habit, had mouth breathing habit and had adenoids. Even after these early habits stop, tongue thrust pattern continues to the adulthood. So according to Moyer, there are different types of tongue thrusting. Simple tongue thrusting, complex tongue thrusting and retained infantile swallow. Why is this a problem? Tongue constantly pushes on the front teeth. It can cause a teeth to move outward, leading to a condition called open bite, where upper and lower front teeth does not have a contact even when the mouth is closed. It also causes spacing between the teeth and also affects speech, especially during sounds like S, Z, etc. This habit can be treated. If the child has this habit, first step is to visit a dentist where they check your teeth, bite and the tongue position. So treatment strategies may include myofunctional therapy. It includes exercises. So child is asked to place a tip of the tongue in the rogue area for 5 minutes and orthodontic elastics and 4S exercise, identifying the spot, salivating, squeezing the spot and swallowing. Next is the speech therapy and also a mechanotherapy, that is fixed appliance and the removable appliance like Holly's appliance, and a habit breaking appliance called oral skin can also be used. So with proper guidance, care, exercises, the habit can be completely corrected. So a healthy tongue position means a healthier smile and a clearer speech. Thank you.